nitroglycerin, nitro, whatever you want to call it, nitro mist, nitrostat. There's several different ones that we have given over the years. The class is an anti-agonal vasodilator, antihypertensive. The actions: arterial and venous vasodilator through relaxing vascular smooth muscle, reduces cardiac afterload resistance and cardiac preload volume, respectively. Myocardial oxygen consumption demand is decreased. Systematic blood pressure is decreased. So again, it's a vasodilator and it's going to make your blood pressure go down. Indications are going to be dyspnea, congestive heart failure, chest pain, uncertain etiology, acute coronary syndrome. Contraindications: hypotension. Again, it's going to make your blood pressure go down. It's a vasodilator, so we don't want to make their blood pressure worse than what it is if they're hypotensive. Or asymptomatic hypertension, or if we talked about this with the chest pain protocol, but the erectile dysfunction medication. If you're going to give it with someone with an erectile dysfunction medication, you have to call online medical control. And I would definitely know these hours. Viagra and Levitra, use within 24 hours, and then Cialis, use within 48 hours. I would 100% know that if I were you. Your pharmacokinetics, your rapid vascular uptake within 3 minutes of sublingual dosing with duration of effect up to 30 minutes. Rapid vascular effect within 1 to 3 minutes of intravenous dosing with ongoing effect while continuous infusion. Vascular effect within 15 to 30 minutes of transdermal dosing with ongoing effect while continued transdermal absorption. The side effects, most serious one's going to be hypotension. Sometimes they will have a headache due to vasodilation, blurred vision, or dizziness. Paramedics should exercise caution when applying transdermal nitroglycerin ointment, avoiding contact with bare hands to avoid experiencing personal side effects. I can tell you firsthand that is true. If you're going to give them the transdermal ointment, make sure you have gloves on or you will start to get dizzy. The dosage, it's going to be 0.4 milligrams sublingual spray or tablet if systolic blood pressure is greater than 100. Single dose unless by paramedic. You can repeat the dose sublingual spray every 5 minutes as long as the systolic pressure remains above 100 until chest pain or respiratory distress resolves. Following initial sublingual dose may utilize intravenous infusion. Start at 10 micrograms per minute. Titrate slowly to effect. Maximum infusion rate without online medical control consult is 50 micrograms per minute. Following initial sublingual use may utilize transdermal application of 1.5 inches ointment to chest wall. I would know that one too. I'll read it one more time. Following initial sublingual use may utilize transdermal application of 1.5 inches ointment to the chest wall. So, and then it just starts talking about the dosing. So that first one was for congestive heart failure. The next one's going to be chest pain. Still same thing, 0.4 as long as the pressure is above 100. Single dose unless by paramedic. If chest pain improved with initial dose, 0.4 sublingual spray or tablet every 5 minutes until chest pain or respiratory distress resolves. Same thing with the infusion as the above. Same thing with the transdermal application. How it's supplied, our spray is going to be 0.4 milligrams per spray. The fire department, we're just going to have the tablets and the IV. Not 100% sure. I know the ambulance has the tablets and the IV. I would assume we only get the spray or anything else if we have a shortage or anything, but it's good to know it all. Tablets for sublingual absorption, 0.4 milligrams. Intravenous infusion, mix 50 milligrams into 250 milliliter D5W. It's 200 micrograms per milliliter. 10 micrograms per minute using micro drip infusion set at 3 milliliters per hour rate. 20 micrograms per minute using micro drip infusion set is 6 milliliters per hour rate. Transdermal ointment in 2% nitroglycerin concentration, 1.5 inches equals 22.5 milligrams of nitroglycerin. And as always, check the concentration and dose per container at time of patient medication administration.